Sampabietia, Chimafidi non kotu, era one radio. Samupe, Jumpabietia, Chimafidi non kotu, era one radio. Oh, and Yumpamtua, Asampamtua, era one,
yeah, a few for wherever you are. Today is a good day for everybody. We heard a whole lot of stories all over the world, but that is not where we are going. We are going to talk about what is very important in our life. Why do you have to have physical assessment? Where do you have to go? What is the benefit? The benefit to us and the benefit to the society at large. Have we gotten anything to do with a financial payment? And how does it save us from our finances? We have Dr. Boison, a renowned epidemiologist and a technologist who is coming to present this thing to us today. And I'm sure everybody will open his ears and stay attentively and listen to why we have to do physical assessment. Very important health wealth for you. So please pay attention to listen to us. I introduce Dr. Charles Boison, who is at the studio now to present this message. Doctor, if you have something for us, please go ahead.
All right. Good evening, ladies and gentlemen. I want to welcome you to One Radio. We've been having some technical issues tonight. My computer is misbehaving, so there were some glitches tonight. Anyway, if you just tune in, you are listening to us live from Facebook and YouTube. Let me see. I think what is going on? Yeah, you're listening to us live from Facebook and YouTube. The number to call in is 240-280-2633. And if you want a text, it's 510-931-0946. And my greetings to you all. Well, before I begin, I just want to ask Dr. Opoku-Agyemang a couple of questions. Not even questions, but normally we do a warm-up before our broadcast. And what has been trending today is the coronation of King Charles III and his better half, Camilla. So I just want to ask Dr. Opoku-Agyemang what his takeaway for the coronation ceremony today.
It's interesting because I watched this around 1 o'clock in the morning. I couldn't finish watching it. I was so sleepy, so I went to bed, and I have no clue about what happened anymore. I saw that a lot of people were just online waiting to see the king, and for somewhere along the line, the king came and he was greeting everybody, and I saw his elder son there, also moving around greeting other people, and that was the end of it. I have not been able to view it anymore. So it appears a lot of people all over the world went there to witness it. But one thing that I saw was that it was more of gold shining all over the places. But where did they get all this gold?
Well, it's as if most of the gold that was parading, I'm sure some of them were gifted to them by Ghana. What do you think?
Actually, when you look at their colonial countries, almost all of them were sources of gold draining. You look at a place like Ghana, look at Nigeria, and other Congo and other places that, not Congo, Kenya, and the other places that they went, India and other places. A lot of gold were in this colony. So, colonial masters actually took advantage of getting a lot of gold for their colonial countries. And sometimes people are saying that it has enriched them and we are poor. So that's what I can say about it.
All right. Well, they are rich and we are. I don't know whether Studio Manager can play us an ad. I'm trying to get my PowerPoint so we can get this, but because of the glitch I had, it's been quite hectic trying to get these things working. I may have to resort to. All right. So tonight, what we're looking at is we're looking at the importance of annual checkup or tune-up. And because of the glitches, I may have to get off my other screen. Well, what is health checkup and what is tune-up? Let me use this analogy of a vehicle. If you have a vehicle, of course, every 5,000 miles or 3,000 miles, your mechanic will tell you, come and change your oil, tune up this, do so and so that your vehicle will work the way it's supposed it was designed to by the manufacturer. So because of that, we don't hesitate. I mean, there are some people who actually don't mind, will drive their vehicle for months and months, years before they do any oil change or any maintenance. But if for those who are astute on, discipline on doing that, you realize that every 3 months or so, you have to go to the shop and change your oil and do all that. Then when it comes to the body, what do we do with our body? We have this temple we're living in. Every morning we wake up, we stretch, we eat, we drink, we go to the bathroom, we pee, everything. And so for a whole number of years, our body is working the way it's supposed to. But it comes to a time where you realize that your body is not functioning the way it has to. And that is why you need this checkup. Of course, at certain age, when you get a certain age, you are required to do some things, especially when it comes to colonoscopy. Maybe 45 to 50 years, they will tell you have to go, they'll put you to sleep and check your intestine, make sure you don't have any polyps or nothing that might, lead to cancer or anything. We have to do that. And so if you ignore stuff like that, later on it will cost you. That is why it's very important that we adhere to all these annual checkups and tune-up and all that. Because if you're talking about tune-up, when your vehicle goes to the shop, sometimes you have to change your spark plug so your car can start very well. What is the spark plugs in your body? You have to make sure your kidneys are working, your lungs are working, your heart is popping the way it's supposed to, and we have to do that. Just this week, I think I put on Facebook that we have to watch what we eat. Otherwise, if we don't control what we eat, a time will come sooner or later that we will be forced to eat what we don't want to eat. I don't know whether I'm still online. It looks as if I went out. Let's see.
You're on. I can hear you. All right. So go on.
You can hear me?
Yes.
Yeah, my system is gone off. What a day.
Yeah, just talk.
Yeah.
It's coming.
This substitute computer is not helping me at all. I mean, just give me a
Even
minute.
though your sound is out, everybody can hear you.
You hear my, yeah, I can't even see my screen, okay, I'm back now. All right. Okay, so let's look at these. What is I did a little bit of reading, and this is what I found out for this health check. And I kind of tried to do a little bit of study and take some case studies and look at some of the readings out there and pick one that is suitable to our study and make sure it's authentic. It has information that will be relevant to our listeners or our viewers. And one says the regular checkups are beneficial for people of all ages, which means it doesn't matter whether you are 1 or you are 79. Even when a baby is born, after 3 days or so, a week, they have to go for wellness check. Make sure they are breathing well, they are eating well. These are all checks that you have to do. And as adults, it gets to a point where your doctor won't say, come every 3 months for me to look at you or whatever. But that yearly thing is very important. I mean, with where I work, it used to be 5 years where we're required to do the 5-year checkup. But now they brought it to a year. Every year you have to go. Even if your doctor doesn't see anything, it's better to detect something in a year than wait for 5 years before they get it. So, and these can help people identify any issues that is starting. Maybe you did yours 5 years ago. Right after your 5 years, a year after, maybe you developed something that you didn't know. So you are thinking you have to go back the next 5 years again to be checked up. If that thing stays there to the next 5 years, it might end up in a disastrous event. So it's very important that we go see our doctors yearly. Sometimes it's okay, you are too healthy or you are healthy, so I don't want to see you every year. But it depends on what they say. But it's very important that the whole year you should be able to at least go see, check your CBC, check your all that stuff, And so the more we know about ourselves, the better we can get treatment. If the doctor knows more about you, okay, last year your A1C was so and so, this year it jumped 1 unit higher, or your cholesterol was 199, this year it's gone to 203, then you've jumped the required range. And of course, cholesterol has to be below 200. So if last year was 199 and this year is 205, then realize that it's gone up, and that's the only time you can know. All right, so I mentioned the vehicle, but I want us to look at the 5 reasons why we should get an annual checkup. And one is to get a current assessment on your health. As I said earlier on, there are family histories, your lifestyle, your age. There are some diseases that don't show up until at certain age. So depending on your age, it's very imperative that you see your doctor for assessment, for them to use their equipment to hear your breathing, make sure there is no weird sound, because anything can happen. Your sleeping pattern, your sugar level. It's important that they assess you and make sure all your functions are working very well. All right. So let me also talk about to update your vaccinations. There are some vaccinations that we took them when we were children. Some, when you take it once, you don't have to take it to maybe after 5 years, after 10 years, after 15 or 20. You have to go and know which ones to take. Of course, vaccination like flu shots, for those of us who take it, you realize that every year you have to go for your flu shot unless you want to escape. But now, I don't even know whether with COVID that came since 20, all these years, now we don't even know whether every year we have to. I mean, most of us have gotten our 3 shots. The first one, the second booster, and then the third one. We don't know whether it's going to be a yearly thing, or I know the president has declared the emergency on COVID over. We don't know whether this thing is going to come back again or it's going to vanish. So it's very important that we are up on our vaccination. And then we also have to review your prescriptions. One of the reasons why you need to do your annual check. For instance, if your provider or doctor put you on any medication, sometimes they want to evaluate, monitor, and see whether the medication is working the way it's supposed to, or a higher dose is required, or eliminate totally what they gave you. Sometimes some medications don't have to stay with you to the rest of your life or whatever. There's a point where the doctor can say, okay, looking at your results now, your results are within range, so I'm going to stop it. Or if they continue, might be dangerous. So they have to do it. So you have to review your medication. Make sure what they gave you, the dose is working. If they need to, boost up a little bit to attain what goal they are achieving, then they have to do that. But without you going and just goofing around, you wouldn't know. So that's one of the reasons you have to go. I mean, review your medication, and also you have to, whether there's a change in the lifestyle, that's very important. Because if you're exercising just once a week, and so your heart is not functioning the way it's supposed to, or you've become obese or something has happened, the doctor will tell you, last year I saw you in this medical practice, your weight was maybe 165. You saw me today, or I saw you today, and now you are 180 or something, which means you are putting on so much weight. So that is the only time you can know. Of course, I know with you having your own machines at home, you kind of measure yourself up. But sometimes when you go and the doctor tells you, that gives you the more impetus to do something about it. So a reason why you should see your doctor is maybe have a discussion on your lifestyle change, and then also save money on long-term cost. For instance, if you delay a treatment for so long, the time you go to see a doctor, it might be it might be too late. You delay so much. Now there's so many treatments that you have to do to catch up or to make up for what you lost. And that's a lot of money that is going to, cost you. So it's very appropriate that when it's time for you to do your checkup, please do. And like I said, one of the reasons is going to be cost beneficial to you eventually, because what you could have just maybe been prescribed or your doctor could tell, just change this about you and it's going to work. If you don't do and you tarry, you keep on postponing, you go in the next 2 or 3 years, now you are in a range where surgery is required. That costs you money. Even if your insurance is paying, you may have to do a copay. So when it comes to that aspect of it, it's going to cost you. So it's very important that within this year or so, at least, just do a visit. Hey, doc, I just want to come for you to check me up and see if my results. Just order some labs, some CBC, complete blood count. HIV is not always required every year, but your chemistries, your panels, your sodium, your potassium, your liver and all that, you want to know where you are, because every year stuff happens. And as we grow, our metabolism kind of decrease. And so you are storing more stuff in your body, and that is the only time you're going to know. So at this point, I'll let Dr. Ernest come in over the 5 reasons that I gave for why we need to get a checkup if he has something to add. Doc.
Thank you, Dr. Boison. I just want to ask you a question before I continue.
Okay.
You've told us the need for physical assessment.
Okay.
When I usually go to my doctor and he tells me what I'm sick or not. So when you tell me about going for physical assessment, are you telling me that going to my doctor for certain particular kind of illness is also not necessary.
Oh, I didn't hear the last part very well. The last part, I think it was mumbled.
Is that if I go there, when I get sick, I go there and then whatever I needed, he gives it to me. So having done the physical assessment, doesn't mean that I don't even need to go to the hospital anymore.
Oh no! You definitely have to. The annual assessment is okay. That is, you are not sick. Let's say this is a routine thing. You are not sick, but then you schedule that every year, doc. I'll come and see you whether I'm sick or not. But in terms of within the year, you can be sick, and you have to go and make sure they look at you, diagnose you. But then that is different from your annual checkup. Annual checkup is like somebody who is not sick. You haven't been sick, but it's become something important. Okay, I'm not sick. I don't want to wait till I'm sick before I go and get some things done. Going for that annual check is like, okay, I'm good, doctor, check my ears, do my oral exam. Let me, present your blood samples, because the life of any animal or any human being is in the blood. So you go, and apart from the physical thing, maybe I'll come to that later. Apart from the doctor checking your eyes, your nose, using a stethoscope or whatever, your breath, everything. These are things that they're going to find on the physical, but then they draw your blood, they ask you to go to the lab, they draw your blood, and the blood is going to determine what is in your system, what is working you. Because the doctor cannot just look at your face and tell you your sodium value is 150 or 160. There's a range. And he can't tell you your sugar just by looking at you, because, oh, Dr. Ernest, your sugar level is 120. The only way they can detect is what? After he has seen you physically and checked all your body parts, he has to take you to the lab for you to draw your blood. And most of the things that are worrying us are in the blood. If your kidney is not working well, they have to know what your creatinine level is, your liver enzymes and all that. They only detect that from the blood sample. So they ask you to go to the lab, draw your blood, and then the results will come. The doctor will see us, okay, the lab results are here. Of course, nobody can look at you and say you have HIV or AIDS or whatever. Everything is in the blood. So apart from you being seen physically, doing your blood work is very important. And back to your question about you seeing a doctor when you are sick, and even that annual thing, they can tell, okay, last maybe 3 years or 3 months ago, you were sick with this, and we kind of treated you, give you some medication. We want to reevaluate you. So even if you're sick, sometimes they give you a follow-up appointment. So that appointment should be able or could fix your problem, your sickness. So for a while you might be okay, but then that annual checkup is still important, because they can look at the medical record and say, okay, you were sick so and so, and the reason why you came is now okay. By looking at you from your top to bottom, feeling you or whatever, Ghana people can say, they can tell if everything is okay. And I think you put a question like, can my doctor alone do my assessment? Well, it's not only doctors. We have PAs, we have maybe nurses. They can look at it, but ultimately the doctor is trained to be able to know some things that not all nurses can detect. Some of the nurses have worked with doctors for so long, they can even act as doctors, but by virtue of licensure and all that, it's the doctor who has to sign you. These days, even PAs can sign on your assessment. So it's not just your doctor. PAs can do it. Anyone who is your provider can look at you. But if a nurse look at you, then I'm sure they have to escalate you. Okay, this is what my assessment is, but then the doctor has to sign. I don't know whether that answers your question.
Yeah, I think my questions are answered. I have another 2 pertinent questions related to culture.
Okay.
In some cultures in this world, more particularly those who came from the developing and the third world country to the United States here, they have from culture that they don't want people to see their bodies, including the women. So, as you know, physical assessment, annual physical assessment is very significant for them to detect certain areas that can even lead to death, particularly something like cervical cancer and breast cancer. Looking at what you said something very significant. You compare human body with a car. For the car, you need to make some kind of assessment every time that the car runs for about 3 months or maybe 1 year or something like that. And then when you come to human being, we cannot open anywhere to look at those things, except to do some physical assessment or go to the hospital doctor or the whatever you're going for them to show you what you have. How can we neutralize this cultural factor so that people of this community can assess physical assessment?
All right, that's a very great question, Doc. That is why we have Era One to help us inform teach and educate our people. It's all a matter of education and communication. When you talk about the culture is just a way of life of people, and so there comes a time where we have to learn. Of course, when you and I were born in Ghana, there were so many cultural norms that we came to accept or we were introduced to. But then traveling all over the world, sometimes realize that some of these cultures are archaic. Okay, I know. Let me use this example of even religion can also be even a problem. I know there are some religions that don't accept the blood of other people. They don't accept blood transfusion. And I know a story of a very good friend of mine. He was older, way older. We live in the same neighborhood in Ghana. And his daughter was sick. He was told that the daughter needed a blood transfusion. But the man said, our religion doesn't allow transfusion. And the doctors advised this man, hey, your daughter could lose her life if you kind of don't give your consent for the blood to be transfused. He said, no, I'm not going to allow it. Guess what? Your guess is as good as mine. This girl died within a week. So whose fault was it? I'm not saying I'm breaking anybody's religion, but then sometimes we have to. I mean, scientifically, it doesn't hurt people. All right. So to the culture question, we are studying and we are researching and we are getting a lot of education. There are some things that were taught to us, our forefathers. Maybe there's like, just Anansi story and all that stuff. They pick some of their cultures from Anansi stories and it become a norm. Okay, we see it. And because we see and see, yeah, say. And also, you and I know that because you don't whistle in the night. Who gave us that thing? Who taught us that we don't whistle in the night? I mean, I don't know where it's coming from. Maybe something happened and somebody was whistling and somebody woke up or something and said, okay, and it became a norm. We grew up to understand it, but we haven't questioned why are we not whistling in the night? So there's some of these things we'd have to understand. Now, as to the body, well, if you go see a provider and because your culture tells you not to let anybody see your nakedness, when you die, what is going to happen? What happens to your body when you die? It becomes isn't a public view. I mean, they dress you and they put it in a coffin, but then when you die, your body is now, let me put it in quotes, no use anymore. Anybody can play with your body. And so if you're not comfortable with, let's say, the opposite sex coming to look, request for a female doctor, hey, menya comfortable say I remember when I was in Pensacola, Florida. I was then in a Navy, but then Saturdays, I was doing EKG and doing phlebotomy, na me chimoja and me EKG, checking people's into me collect be a room and some EKG. And of course, I have to put the electrodes on here, the waist, a top one. I mean, remember, no shirt now the electrode, not just watch again. Girl, young girl. I mean, no ginger who's about me to say, Nenufu officer Nenufu FNT. Mammy, yeah, mama and Fay, and she baby, I said, mention Nenufu. I had to. When I closed my eyes, or I was able to put a lotto somewhere, and I don't know whether the graph I got, the chart I got was accurate, but my guy is on Pinma Minfay, on just a Nufun on being Hokana Minfay, or just a Nufun, if too much, in of them be actually. In culture, we have to educate people. We have to, it's a must, because some of these things will make the culture eventually you die. And then and we have to even understand why we have that culture, why we are so much, obeying and I say adhering to our culture so much. Say we even tend to forget and even learn why we are obeying that culture, because there are so many things we do now. How did this thing come into existence? Have you even researched to know why? Yeah, Unanaka say, yes, and okay, infants for instance, Opoku going fishing. Ghana almost everywhere Tuesday beyond young couple. Until say the Minister of Fisheries, Agriculture, because okay, and now no munjama o munyini, because every day more fish in kitten going to mean on what I can see every day they are being fished. Into because okay, for one day in a week, your man born in a day, you call the following day to make more harvest. That is a scientific approach. But then Obika said, Benade be a Ghana no, young couple. So couple saying soon before up to now, I don't know. Until when it comes to medicine, that's our life now. Some of the cultures, we have to understand why we don't do them. Otherwise, we'll lose our lives and you can't blame anybody. If God didn't say anything in the Bible, and I say, maybe affecting culture, no, it's a way of life. And sometimes our leaders in Penifon and they have to go back and revisit those cultures and ask ourselves, so our culture, follow hundreds of years, what are we doing about it? I hope so it helps in that area.
I think you have gone far into it. Let me just add something that is very unique about this. I was reading one literature from I think Egypt about cancer, breast cancer, and according to the researcher, what came out from why the women were not showing their breasts was that they were afraid that when they are diagnosed of breast cancer, it's possible they will lose their husbands, and that's
Really?
why
Okay.
they're not trying to let anybody access their breast at all. But I think this is very unique. You see that, like, as you said, there are certain history behind any culture that is exhibited in the community. And looking at all these things, we have to go into it and make sure that it is clearly supported by scientific evidence in order to use it. Other than that, people are going to get sick of certain disease that could have been treated or prevented easily. Thank you very much.
And to add to just Doc, I mean, just to add to what you said, it's a very good point that you were saying something like the women think that their husbands will divorce them or leave them because they have breast cancer. That is why it's very imperative that when it comes to your health, although it's your health, you have to include some family members. And you will disclose it. But when who can for the would do some crisis, you have to let your spouse know what is going on. For instance, maybe you went for your annual checkup. And our doc is so okay, looking at your BRC and your breast, you are developing cancer. What you can do is, hey, come home, talk to your husband. This is what the doctor said. Would you please accompany me to my next appointment, or schedule an appointment and talk to your doctor? The doctor will explain to your husband and say, hey, Jack, this is what your wife is going through. And you're doing no good and I say but it's not something that grows into. Let the husband understand and know, say, shoot, in case. So you're gonna bro from the shoot in case. Should anything happen now, the husband will know. So okay, me in a appointment. The doctor may explain and say, this is what is going through my wife's body. And I have to understand. No, bow don't know the no. Not now until say cancer put the at that point. She's your wife. You already made a solemn vow and oath, say, in sickness or in health or in death, you will stick with her until losing her breast. And that is not what is going to make you divorce her or leave for another young chick. Until so when you're in a appointment now, the doctor can explain to both of you what is going on, so you appreciate better what your wife or it can happen the other direction to your husband. They will understand. So okay, this is what is going on. Just say in the eventuality is here, then each other will be at here. And if papa no beka so no say one kan che na so doctor but say wo no kunya na ko for check up and bibisa na see explain now you know what is going to man into me and you see explain. It's very important. I just have to add say important say the husbands will also have to understand what is going on, whether it's the wife or the husband. Both of them either have to understand what is going on with the other person's body, because of course the body belongs to both of you. Oba bia ntumi nka say me body me nkwa me dia even Paul can say then me and fire huna me the en come here into your body does not belong to you, belongs to both of you. So whatever happens to your wife in a way happens to you. So that's very important. Yeah, let's move.
Let me just ask another question. This is more of IT. It also came into one of these research that I went to. Again, in my own research and the research that I read from other areas, particularly places like Australia, there was a lady who wrote something about the breast cancer and cervical cancer. The woman was emphasizing that particularly Ghanaians over there and other African foreigners were not doing basic assessment so that they will be able to know the onset of the cancer.
Whatever is going on, okay.
Yeah. This happened somewhere in 2011, an article that was written there. And if you look at the outcome of the research, they said these foreigners found it very difficult to navigate the healthcare system in order to know where to go and when to do this assessment. How do you look at it from this perspective about physicals that you're talking about?
In terms of breast cancer information, Anna?
And yeah, breast cancer, if all other things, they are assess health system, because they cannot access the health system and manipulate it to know what they have to get in. They are sitting in their homes, they don't do anything about it.
Well, of course, we are in the 21st century, and I know that not every country is developed, but we have to do everything. But I think I read something about that research, and it's very important. Say, our leaders, in fact, leaders in Africa, some countries, we have to do better. We have to do that, because if we are imitating the cultures even from the United States and other developed countries, if we are developing their culture, their dances, their music, we also have to make sure we are adopting their technology and everything that will help us. It's also and in the technology that can help one, it is very important. And with this breast cancer thing, some of the ladies were even shy of going to the doctor. That is the problem, which is misnomer, and sometimes we don't have to put up it. Why wouldn't? That's why we are talking about this annual checkup. Why don't you want to go and know what is going on? Of course, we would basis some economy and same family who they are sending when near and your time. But we are in an age where education information is very imperative. Until with the researchers, what we can do is to encourage our leaders, our media people, to make sure all these things are being eradicated. Education should be brought to the fore. We used to say, don't even educate a woman. But Kojage can be say, if you educate a man, you educate an individual. If you educate a woman, you educate a whole nation. Until in this century, a woman there, education is very important. Into the leaders who are involved, whether it's education minister or financial, whatever it is, we have to make it our prime emphasis. We have to reach out education to the schools, to the communities, make sure they are getting all the information. Going to see your doctor is not a sin or something that should be shunned. It should rather be encouraged. It's very important. I mean, I'm not going to downplay this now at all, but it's very, very important. I just did my annual physicals this week, and there are some things I have to change, apart from exercise, SME increase, there are some things there's some food I have to stop, or go on the loan. See, to your question, our people will have to make sure education is very important, because when you enlighten people, they know what to do and what not to do. So cancer, you don't want to wait till a due stage where it's too late, because it's too late, and the doctors will say, they say it's too late. That is why even the colonoscopy, I was a member, I used to be 45, 50 years. Now they're thinking about bringing it even closer. You don't have to wait till 50 or 45 before you do it. You can do it earlier, because some of the time, before we do 50, now develop too late. Back to your question, in fact, we have to find a way of drumming this message as a public health experts and as students or whatever it is. We have to make it our prime emphasis to make sure our people are being educated on all fronts, not only how to make money, but also how to take care of their bodies and make sure the machine, which is your body, you know how each of them is working. Go get your eyes checked. Make sure your vision is not going there. If it is not a glass, because every year your vision kind of changes. I mean, sometimes, lens either they have to increase it because your system is deteriorating or something. See, you can't say 2-3 years and I say no, you can't do that. Even in dental areas, you don't sit there and say, okay, dentist. No, you have to do it routinely every year. Okay, cornea show x-rays now. Bones name before man, I said nothing. What you don't want to hear is, it is too late. That's what I'm saying. I think that's my summary. Don't wait till it's too late. Do it. Make that routine thing so that they can check. On your birthday, trust me, just make it a mark. Say, on every birthday, make sure at least before your birthday, around your birthday, that's one area you can remember, because your birthday, you are reflecting upon your life. Where has God brought me? Where is God taking me? How about your health? At least every year, be around your birthday. Daytime, let them check you. The baby I'm checking the cancer. So what? It's better being detected early than waiting to the last minute. I guess maybe I try to answer your question a little bit.
Yeah, let me just add a little to what we have.
Okay.
Maybe we have to talk to our people, so I'm going to speak too. Besides the individuals in the community and the people in the community being educated, our health professionals needs to be educated too.
Exactly.
Health professionals back at home in Ghana, as I said, we catch more clients and as more patients for manual checkup. Somebody can report one malaria for more than 300 times in a year. That's ridiculous. That one person reporting a disease that is preventable to the same doctor, the same hospital for more than 40 years. I think we need to do something here. Because the medical professionals are not doing their work well, neither the patient nor also know what he doesn't know what he is doing. And I believe that the medical professionals should take a time to educate the patients. And I think when they educate them, on the fun more, since any other person be a co educating.
But Doc, can you remember? Said there was it last year? And the said doctors. How many? I know it was over 100 people. Doctors every school. What be sir?
It was a fly in the air.
But how can that be possible? Say doctors are graduated every school now over 100. I mean that is impossible when we have villages where people need to be cared for. Even if someone put them as a national service. That's what we do when we finish our university and sixth form.
Docs, I never be on my politics. To me, I don't look at them. Politics. I don't look at it. Now, Doc, let me ask you one significant question here. We see, sir, not a question. Let me just answer before I ask the question. We see, sir, when we call physical assessment now, what can we see here? They give you some advice, particularly. We a Bema, they ask you, sir, testes, do some kind of exercise in there to see what is happening to your testes. And man, also, your children said they almost examine one more breast for breast cancer. And that's examine one more cervix now, cervix for ovarian cancer. And this animal wing now, quite a bachelor, no why in if you bar, why be in fee, maybe almost be every after your menstruation, as a prior menstruation, you have to do a breast test and see if there's any lump in it. Then you report to your the prof person what you said. So yes, sir, you are saving yourself. It is reported said area and they live longer than into a certain stage B in cancer and as a cervical cancer certain stage B. And that is one important thing. Physicals. When you go and you see any tiny thing be in your body and sound well to yourself and not to your health now, don't hesitate. Quickly go to your doctor and then ask for a total assessment. Doctor, a good technologist will when you come into blood examination, other things in the lab. What kind of every single blood particle has something to tell the doctor or the physician or the medical team what is happening in your body. Now, doctor, let me ask you this question.
Okay, fine.
Sir, your time, I can't just 15 minutes and come in and say, on Pami in free studio.
So your glitches near Yan in Tema.
It's in home. I didn't think that when you're going for any employment, they ask for physical assessment. Why?
Well, it's because say insurance is involved. Insurance is involved in say one person who say you are healthy enough to be able to at least give them about 3 or 5 years of your life before BBSC. And health is very important. Of course, insurance now, like I said, no, they have to the company, some companies in your beer and make us but health insurance. They have to know say later because the good thing is what Obama came to do. President Obama or the healthcare by now. They try to get away with pre-conditions. What the pre-conditions? The biana won ankasano. We are serious yarophobia just or china now okay, I better say insurance in. Now insurance because so much almost show almost so much doctors and the doctors now so yare. Now much no much can be jamu their tom. Into Ubana so we your yarefo and say first so major procedure bia. Guess who is going to pay? And some sure said before at least one yet what I would say or you're for serious beer. What do you now be 2 so into Obama so okay so insurance or pre-condition be our kumayara and answer will live. They shouldn't look at that, but then they should still give you some health benefits. Into a Jumano or person sure say one can say in the first place you are capable of doing the job. Ubet me and what ubet me. I mean these days are COVID by interviews online. Into the share that in physically. They were still doing Zoom online interviews to take people versus earlier on and they said Uba physically manager no interview nankasa or tin enim nankasa or share the way you are speaking, the way you're expressing yourself, your mannerism, the way you move. Somebody can tell. Like sometimes I don't know physicians or doctors, if you were interviewing, they can even look at you and say, "Quite well to an for own." But to your point, they want to make sure say you are healthy enough to be able to come and do the job. No beer. We are yare for every week, be an every 3 days, be an oh boss, I say me call me doctor. We are sir, what block beer no you're healthy enough and come then obey me you on problems because if you have 2 candidates, that's only back when yare for serious, never healthy. No more coffee yare for now. Every 3 days or every week be an best quite say me call me doctor. But healthy one no. Oh, even age, age should not be a discrimination for employment. But trust me, will be for and say, okay, back when the 72, no back when the 38, one out here before. More the same qualification. So even Chrome can say we president, bad in Kwan. I didn't think the rates is here from. And as I be more, I can say, you empty to money. Why? Or your competent age, but almost when you do. Almost had to money be a time of the office, no, 86. 86 no even Nikki Haley crap a project say bad won't mean the term of office no age which to me is bad. You can't predict somebody's death so we in office until you know issue but waka so papa no when you don't see the second term there 2 managers say trauma vice president Kamala Harris no so papa there 80 after 8 no kono on to me which is bad one in him. Yeah, Nyankopon said this year no me person me mad other some miracles so me so akwani kwa no if you do 90 year obewie ni 86 class at na once we won't tell you plenty. To your question no employers they want to make sure say they are getting somebody who is fit who can do the job because who will be a debia me nkofo be adwuma wo North Carolina. I'm some of my co-workers are zig I said be or banking on Belgium so I'm sick today sorry I can't come to work they be not into yes and adwuma say nipa 5 na say adwuma now. What is so I'm saying aka for ombebre inti employer bia no the first aka book me so don't discriminate say no my friend me fa wadwuma na so me hwen say wo ho nya din wo be say kwan de bia say wo ko hu doctor wo yare obi ko on ka so ko hu doctor po o tenefi ni wada o na me don't pay me nya me sasa bo na ba inti be say mo ho me into be sure say dey no emba so inti to your question no they want to make sure say they are getting one a healthy individual bet my age one and a 2 insurance also embo because almost payroll and some systems so they have to afford some of your health insurance until we are for next okay we badge be the following week and the following month no yes we come aside yes pay transfer and I say be a costume they don't want to do that until be employee be and will look at some of those factors to make sure say they are getting a healthy person. I think that's the short aspect.
No, 2 more questions to ask them. Person will challenge into your time. Wait, man,
Okay.
The next question is what are some of the social interests with this kind of physicals? Has it got any social interest?
Yeah. You know, wouldn't say the funny thing is that I mean a few doctors were saying so so nipani healthier and yeah important so be annual you know say well it depends you can argue it in both cases say be okay so nipano healthier and so sure but me I don't mind say me check but the social interest one doing your checks is very important because at least it shows say you are following up some regimen and I say you are healthy enough to stay in the society and I know social aspect so one can say wow I mean so if your vaccinations and your shots are up to date you feel confident walking around. So when you're vaccinating for your own vaccinating for 3-4 years, I don't know how you feel. But yeah, no, because of your humanity, I say every year, unless you have a reason and I say a waiver, you have to do your flu shot and other things every year. One year, to me, 2 promotions. One, if you are delinquent in one of those vaccination, to me, every draw promotion, you have to be deployment ready because you're deploying every now and then. You have to be deployment ready. So, social factor, and one, it gives you the confidence to work among people. So, okay, my vaccinated, I'm up to date on my vaccination. I am okay. I'm not scared. Say, and I say, it's very important. Say, one can check your numbers. Example, I mean, your BMI, so where you stand. There are ranges. We don't have time to go into all that. But if you know your range, it's very important. Also, but if you can the BMI, and yet that extreme because the height in the weight make up for it. A balu, and you have to look at all those things. Your social values, I mean, to me, you are confident in yourself. You know what your levels are, labs, what it is. I mean, your eyes, everything. And it saves the economy too. Because we are weighing as a doctors no one in them, almost detecting them, and some more preventive from disease. Yeah, social, it helps all of us. You don't become a burden on the economy. I mean, money has to be spent so much on people who are bedridden.
You're going for, I'm going to ask you a question over there. Let me just ask that question. I think that what can you see here now was social because you become very free when I'm
Exactly.
so I just want to just like when I'm coming back more and you're beneficial. And let's go to the last question. What is the significance of a physical to financial benefits in your family, the community, and the country at large?
Okay, well, I think our slogan is "Health is worth protected." Era one, yeah, health well, let me see the division of our health in Era one a radio. Health is worth means when you're healthier, you are worthy. You don't spend extra money on unnecessary things into your family life. Once you know where your numbers are, it gives you the mandate to exercise yourself or do something. Make our 5 reasons why we should do the annual checkup. It saves cost because so we name medical history and I say what is going on. It could be said genetically, parents, a transfer, genes be that can make you sick in certain areas, whether it's cancer or obesity or whatever it is. If you know, say your family, this thing exists. But if your annual checkups, otherwise, that can help you to prevent it. It's in your genes. Yeah, the amount, who parents the amount, who one copper for it to just because of by birth near the amount, you can prevent it by what developing a different lifestyle. Oh, my parents here, they were obese, and I said I can do something about that. I can resort to doing exercise to prevent that. Until financially, you are saving your family from excess money. I'll be trying last minute. If you make out just I think I'll treat you now. The family has to spend all their savings to treat you, which is very bad. It is who detects some of the yarn in tema, whether it's cancer, breast cancer, whatever it is, whether it's your PSA. For instance, let me just throw in there. Remember, no PSA, what it leads to prostate cancer. There's a value. If your value is more than 4, then your doctor is going to be concerned. You have to be concerned. But so we just ask screen every year now. They can tell last year your number was maybe 0.3, about 0.5 increase. They will warn you or tell you some things you have to do to avoid. And to one yes, I say a last minute and if would the carb to a so it's very, very important. Say you do this checkup to know medical where you stand and what you can do to change it because one can say, yeah. Angwa munkwa na wudi brokoto na wudi aduane bi obenya bia the left and right now zoom well we are now we na 2-3 years doctor last minute ubekobeka is bia cholesterol da 400 just an example. I mean more than 200 who cause them. It's very important. You don't want to waste money that belongs to your family. So make sure because you were negligent in what you should have done. That is why it's imperative to say if you are taking care of your car, which will break even tomorrow, and as a car, no car will last 40 years with you. But your body goes beyond 40 years. Why don't you do the same to your body? I mean, so me brush it once a day. That's enough. But no, brush it. Just common etiquettes are to your question. In fact, if you are avoiding some things or taking good care of your health, you don't end up spending too much money on yourself or you're taking your family's money because there are people they are now bedridden. It's surgery or somewhere insurance bit but coping a bit and it's still huge. And as Enfan said, so who here kidney? I mean the stress you have to go through to make that possible. To your question, it's very important that we take good care of our health so we don't end up spending too much money on family members, other people, and no need to medical bills. I mean, and the medical bills can be expensive, although people have insurance. And I think that's I don't want to talk too much.
Yeah, just to add a few things to it. There be a cost family, be a cost nation.
Exactly.
So, over that hospital. So, that hospital, government need to see you have a fast staff from the you have a doctors from the it makes it very expensive. My last question is, Doc, I want to say in this country, good food are very expensive. So, how can we relate good food eating as a good physical activities to bad food eating, which is not a factor from us that because we don't have money to buy, we have to buy the bad food. Why?
I don't know what you mean by good food, Doc. Okay, food is food, but mostly when we say we spend money on food that costs so much but do very little or even harm our body. What was she saying? For instance, let's take something like can you imagine if all of us were vegetarians? I mean, starting now, I mean, we young quite when you were punching, even though we were there. But if all of us were vegetarians, of course, you can't eat salad for breakfast, salad for lunch, salad for dinner, all that stuff. I mean, once I Ghana put the kasi, I'm also like because Adam ya punching on one rasa no. A video be a woman be or ye exercise we are the trainer burn it, you not burn the salad or say I don't know why yes we not burning punch you no nya habana so do or send for different and I say a baby brand. All right, to your question, they are very expensive, but they don't actually help us. Let me take for instance, walk or restaurant, walk or that ribs, ribs 3 might be ribs. What do you think is going to do you? That's a lot of meat. And from what we know, too much meat eventually will hurt you. Inti say Adriana, one fan say, why don't you, buy the things that you can afford, especially eating at home is very important, better than doing a restaurant. Of course, there will be birthday, family birthday, and man, normal brain. Once in a while, you want to go to a restaurant and maybe splurge yourself and enjoy small. That shouldn't be habitual. Into outside they didn't cost too much. We hear Duane Kakra with fear or the secondum review, a gushi kakra or Ghana food home some peprekes and a mania kakaka to Gumanti, a Duanankasa a mayor healthy no. Yem pen, ye pet rather expensive food no. Oh, sana pass a beer, setin or person man, coffee, sugar kitu ebisa, honey, and as a bibisa, and yes, white refined sugar pea, and a kakra when ya carbohydrate kitu when you proteins kakra nti aduane ankasa a boy ni peduano. It doesn't cost. Take example. Let's go to the biblical example of Daniel. In the book of Nisa, Eka say, "You feed you with all this rich food," and of course you can imagine the kings here, Mamo Duane Papa, Stradinam, Ami, a Janami, Ponkonami, Chese Bate, Bibia, Pibia, or breakfast table. So I am. Daniel said, "No, Pesa, Mama me lentils, Mama me vegetables. No, we are. Won't compare me to Adam Kofano or Hinema, Mom Stradinam. Who excelled?" And Bible said that Daniel was far more preferred, more mature and handsome than other guys. See, what am I saying? Instead, you need people hire spending scape, it doesn't actually help. We have to know what helps us. We have to make sure we are adding more vegetables to our food, fiber. That is what helps. But restaurant ne pay birthdays ne, excuse me, kwaji any pay straw name pay French fries, cabo pay, you know, cost pay eventually. You don't have. So to your question, let's try and eat what we can afford. Me book now make sure, of course, would dissertation, I think. But maybe there may an obesity. I made me book, Me interview for around, Obi or ni second doors into Nyeska. What does they buy? What do they buy? They go maybe McDonald's, no akoto, be a French fries, a burger, I mean, putu, there, Instead, so okay, Obeka so salad the boy, and I say salad name, but that is what the nutrients are. Inti yen try say yen spending too much on necessary nyama. We think they are so fancy food that kwenya and nam kakra. Even they warn us at certain age kwani nam pino and yema when your poultry kakra mo say I can't nam u 7 no one faka 10 eye one faka nte bi ni bi anyam kwan na bu afu. Inti emema ni benya yen watch aduane edi. Most of the things are cost so much money they are not even healthy. Inti let's go for the vegetables, the fibers that help our body. I think that's what I'm going to put it. As my wife will say.
Yeah, and Dr. Wesley, for all your education that you have given us today. You can be physicals. Now you go from the internal to the external. So the call or lab, other cardio training and master baya. The who said the bia person baya 1 year by. In fact, you go and say you prevent diseases, you prevent malformations, you prevent idea unforeseeable. Now through physical and catching up, so the bear and yet as a duty na more cabin. Now we say how much that is the goal of your health is well protected. You're going in. And today, Dr. Boison, am all the information that we need. So the bear particularly. I did not hear him say, "Pa me cast man teaching." assessment of healthcare no I call it no internet so no on my head I say you chrome some bomb now mama training be for how to enter into the healthcare system even when you come outside the country. No mama ba no so no don't hesitate. Mo say obi a screening na screening is free. Omo general one is free. Ukwa no busade no mo if it is very important so be ya koye bi na aboa na bibi kitu obi ahinta ho na mama example say mama Dr. Boison na a brief for the oye nyina hwe na me wo school e Takoma Park na ye a health assessment for the whole community will be a train bia na friend and one gentleman be you produce on your friend no na your friend no he was reluctant to come wasn't why late okoduma and you so brana you checking blood pressure free of charge you checking the blood pressure no one 280 120 and you say blood pressure was really the one you are stroke what are you doing about it and akwesi why you need Kasan here at the hospital. Takoma Hospital, Adventist Hospital for some time. Or the whole 2 days, as I don't know who so I done also when yet fortunate. I mean, I guess our assessment and blood pressure so they need to here. Give you can bear 3 days, 4 days, no. The better is when you're stroke. You know, with this, no, Dr. Boison, please give us an assessment, a summary of everything that you told us. And then from there, we end our
All right. Thank you very much, Dr. Opoku-Agyemang. So what we've been saying tonight is that prevention, they say, is better than cure. And what does that mean? If prevention is better than cure, then why wouldn't you want to know what is building up in your system before the curative aspect comes in? Because the cure aspect comes in when the prevention wasn't done, and now your situation is gone beyond some point that they have to cure you. But then what we are doing is that we are trying to prevent the situation before it even comes to pass. So what we're saying is that just as you will spend time to go and perform service on your vehicle, change your oil, change your spark plugs, make sure your mufflers, your oil level, transmission levels are all accurate. Same thing. Use the same mentality for your body. Go and get your system checked. Make sure your vision is very important, because at a certain point, you have to realize whether you are growing glaucoma or whatever in your eyes, whether your eyes are still seeing the way they have to, or if you are using glasses, they will be able to tell you whether you need a booster for them to increase the lens, in the glasses or whatever. It's very important. And when you go, they will check your heart rate, they will check your BMI, they will check your nose, your throat, all the screenings, and the other labs for you. Make sure your hemoglobin is within range, your lipid, cholesterol, triglycerides, your HDL, your LDL, because the cholesterol, we have the bad cholesterol and we have the good cholesterol. You have to make sure your HDL, the good one, is at least good enough, and your LDL, the bad one, is not that high. You have to know all this. And you also have to make sure they're checking your thyroid, all those hormones, and your electrolyte, your sodium, your potassium. These work together to affect your heart. You want to make sure these values are all working the way they are supposed to work. So it's very important. So what we're saying tonight is that don't wait till it is too late. Don't say, I'm scared. Oh, like Dr. Enes said, somebody was going to work. They called him. He didn't even know that he had an issue because his blood pressure was high and hidden inside. He never checked it. If he hadn't checked that day, he could have gotten a stroke and died. So please don't hide and say, oh, if I don't know, it doesn't bother me. What you don't know might not bother you, but it can affect you. So it's better you know and you do something about it than wait till, oh, I didn't know. They say ignorance is no excuse. So please do not let ignorance kill us. Make sure you know what's working within you, because the only way you can know some of these is that you present your blood, they test your blood and know that, okay, your sodium is this level, potassium is this, your liver enzymes are all functional. Please, let's stay within our assessment. Take a time, take a visit to the doctor and say, Doc, I haven't had a test for so many months or whatever. This year, I want to don't be scared. It's not going to kill you. It's better they know what is there, so they work around it and give you a solution than nobody knowing it. Eventually they'll say, oh, gone too soon. So no way no be any man because no on course but my doctor in it's very important that you check what is going on in your system so they can give you a remedy or the name. Doc, I'm saying Dr. Enes Dr. Enes, are you still there?
I'm here.
Oh, okay. All right. So in a summary, please, don't be scared. Don't be scared. Remember, especially mo PSA, mo prostrate, BBI function very well. It's very important. And even our body knows you know the blood is everything that works for us. Remember, go and check. Maybe it's because you have too much plug in your system. That is why the blood is not flowing very well for you to do what you have to do. Go and what you know might not even hurt you, because it will help you to get a diagnosis or get a solution to your problem. I think I will end here for now.
Health is wealth protected. Dr. Boison,
thank you too.
Next week, there were a lot of information for you. If you couldn't call and I said, oh, Ghana, dear Sawada, and Opa now be a dear so sure. Now a problem be a with a chat on corner fix problem no one. The following week Sunday this year. You better answer a question. Now they say, oh, Ghana and so on, and now Japan, and now Australia, and now any of these countries, you know, now we get access to the year can year. Now our question be now what you mean friend, what they put in the chat will answer you. He said, Munti and health is wealth protected. Thank you, and thank you all.
Thank you, listeners. All right, have a good evening. All right. Let me cast over a Britain for Prince Charles in the Wooty Hay. Okay, you be share next week. Okay, Bob, and see the doctor. Also, it's close here because my system now, I don't even have any access here. Okay, all right. And me studio them. Okay.